Awesome. Well, I have Daphne with me. So Daphne, thanks for being with us. And could you just give us a quick intro?
Sure. So my name is Daphne Owen. I am an emergency medicine doctor in Philadelphia at the University of Pennsylvania. And I work in a big academic emergency department there. And I also work in a smaller community emergency department at Presbyterian Hospital in Philadelphia.
Awesome. Well, thanks for the work that you're doing. Can you give us just just some background, like what's going on? What have you been seeing the last couple weeks?
Sure. So, I think everybody's pretty familiar with what's been going on in New York City, and obviously the burden of COVID in New York City has been immense, and also in New Jersey. So here in Philadelphia, we were, really concerned about having a similar situation. Philadelphia is a city that has several million people and a really high level of poverty. So it's actually Philadelphia has the highest level of poverty of any of the 10 largest cities in the United States. And so we were very concerned about what COVID would look like here, especially because, we know that people who have less economic resources often have worse outcomes with a lot of different health issues. And we thought that COVID would probably be that way too. Luckily, Philadelphia instituted stay-at-home policies fairly early, even before New York City did, and the wave of cases really didn't start to increase here until after New York. So I think we were able to get a bit of a head start on things. And I think it remains to be seen what's going to happen as social distancing rules are lifted or as businesses begin to reopen. And I think we're all thinking a lot also about the longer term impact of having so many closed businesses and so many people without work right now, and what that's going to mean more just for sort of access to healthcare, medications, and basic necessities for people as we go forward.
Right. So could you maybe just describe what does capacity look like, and how is that and where is it, how is it determined, and where is it at?
It's a good question. I think there's a lot of components of it. One is just physical space. So for example, just having enough physical beds and rooms to put people in is really important. And then I think another really important one, people talk a lot about the ventilators, but the ventilators themselves, that's one important issue, but having the staff and the people to operate those is a whole nother issue. So not just doctors and nurses, but respiratory therapists and medications that allow people to be sedated enough to be on ventilators. All of those things are part of the capacity issue. In Philadelphia, and I think in a lot of other parts of the country, most hospitals and emergency departments run at pretty much full capacity or close to full capacity all of the time. And so one of our biggest concerns was if we get, we're already almost full, if we get a whole bunch more people with COVID, that's going to totally overwhelm us. So capacity then would be, space, medications, machinery, equipment, and people. And the people issue is also important because as people get exposed and have to be out on quarantine, that cuts down the number of workers that we have in the hospital. But
right. And so how is the hospital addressing the needs to have those different people, and how I guess how are those people trained, and is it something they can train on quickly? Is it
so for myself, as an ER doctor, I put people on ventilators all the time, but to actually push the buttons on it to make it do what I need to do is not part of, I can sort of do it, but it's not really part of my training. I rely on a whole nother person to operate the machine. So those kinds of skill sets are pretty complicated, and I think difficult to learn rapidly. So ER doctors and ICU doctors or critical care doctors are pretty familiar with, ventilators and doing critical care. So a lot of, from a staffing perspective, we've been thinking about how to have those people and anybody who has that skill set be ready to do those jobs where needed, and then pull people with other skill sets in to utilize them as they're able. So, one of the things that we looked at Penn was, okay, we needed to run testing sites. So we set up some drive-through testing sites, and doctors need to order the tests and staff the sites. And so ophthalmologists and dermatologists and people who, normally do other things were brought in to do that kind of work. So there's been a lot of kind of readjusting who's doing what and figuring out who has the skill set to operate where needed. I think we've also had just the staffing issue is really difficult because we have, over years and years figured out how many people do you need, nurses and doctors wise, on a given day, right? So how many people do you need to staff an emergency room? But right now that's all completely different because, we don't really have a way to predict, like, next week, do we need 10 doctors on at one time or 3, and so that's been really a lot in flux and fairly challenging to figure out.
Yeah. I mean, so maybe, again, we're looking for software solutions. So maybe it's, maybe there's something around, something to address staffing. I mean, obviously it's very complicated and nuanced, but I mean, it could be something that could help with that.
Yeah, I think that's a really good idea. Even just, I think to compare, like, to have a way to compare, what is our volume like right now or today, to try to predict, okay, in the next couple of days, do we need more people or less people on? Right. Because I think even big hospitals like ours are going to be financially hurting from all of this because a lot of the things that we normally do that generate revenue, like elective surgeries and stuff like that, are on hold. And so we don't want to have 20 people sitting around doing nothing if they're not needed. And so I think having like the ability to help model how many people we actually need would be helpful.
Yeah.
One of the things that we've been working on that I think probably there could be some development around is I have a lot of friends and people that I know in Philadelphia constantly ask me, like, where can I get a test? And honestly, like, I don't really know all the time. I have the list from the city of where you can go and I send people to that. But I think there's like potential for app development or software development around, like, me as an individual plug in what kind of insurance I have, and like it could show me where I could go to get a test. So I think that's like that's a big one.
Yeah, and so for somebody who's uninsured, there's like I've lost my job, haven't been able to get like any new health insurance. I mean, I think that's probably a common situation, right? So like, and now I have, now I'm experiencing some shortness of breath. What would somebody like that do?
What would they do? So it's tough. And that's a little bit why I was thinking about, an app to find testing sites for people, especially without insurance. So, I have one friend who's in that situation who's been trying to figure out how to get a test without insurance. And it's hard to kind of dig through. There's, at least in Philadelphia, and I imagine lots of other places, there's universities that have set up testing sites. The city has set up testing sites, and trying to figure out like which one of those you can go to without insurance and without a doctor's prescription is challenging.
Gotcha.
So it'd be cool to figure out how to, like, put all that information in one place for people. Like, I don't have insurance, where can I go to get a test? So right now, what I specifically use is the City of Philadelphia Public Health Department has a website with all of the different testing sites. So I've just been sending that to friends or patients who are hoping to get a test. It's really challenging here. A lot of them are drive-through. So like if you don't have a car, you can't go get the test. So it's fairly brutal.
Okay. Yeah. So there's a lot that probably can be done. Like, very simply to just get information to people who might not have it. It's
yeah. And most, so here in Philadelphia, most cities like this and other places have some kind of county or city or federally qualified health center, which is like a place where you can go and get healthcare even if you're uninsured. But I think a lot of people just don't really know about that or like know how to access it. I mean, I guess the other thing is just that there's insurance, there's ways to get cheap insurance, there's ways to get free emergency medical assistance. A lot of it's just like that people don't really know what resources are there,
Right. Yeah, and I'm sure it's like it's state by state, county by just a centralized hub for doing some of that stuff it might take some legwork pulling all that information in, but it might save a lot of lives.
Yeah, another one just would be we've been working on figuring out how to monitor people and just check in on them and have a way to make sure that people who are getting worse get the care that they need, and then people who are okay kind of just get the reassurance that they need. And around that, for COVID, really, there's not a whole lot that we can do unless people truly are developing breathing difficulty. So, for most of us who get COVID, it's going to be just kind of like the flu, and there's not a whole lot to do except stay home, take Tylenol, rest, whatever. But then once people truly have difficulty breathing or shortness of breath, that's where we can intervene and give them, supplemental oxygen, or if needed, escalate to being on a ventilator. And so, I would love to be able to put all of my patients on pulse oxes that measure their oxygen level at home, because that would be like a huge help to know, does this person truly need to come into the hospital or not? And that's, they're hard to buy right now. So that would be another like super cool thing, is if there's some kind of way to either, do that from the iPhone or even just like find a proxy for it.
Yeah. So, and so you mentioned this is something that measures your respiratory rate or something like that. Like
the pulse ox measures your respiratory rate, but it like goes on your finger and it measures the oxygen saturation of your blood, basically. So for us, I think they're fairly simple devices. Like there's even disposable ones that we use in the hospital that just stick on your finger like a Band-Aid. And then this is more like a hardware thing, but like it would be really, really helpful to know that information, because that's really an indicator for us of when someone needs hospitalization, is having a low oxygen saturation on their pulse oximeter reading.
Yeah. Interesting. I mean, we can link to it. There might be some people who have like more of a hardware bent in this.
Even heart rate and respiratory rate are potentially helpful. Like, when I'm making the decision at my job, what I care most about is the oxygen saturation, but respiratory rate sort of correlates with that, and heart rate. So if like you're just sitting there resting and your heart rate or respiratory rate are high, that's concerning to me that something is going on.
So by respiratory rate, you mean like breaths per minute?
Yep.
So it could even just be something where it's like, hey, record your breaths per minute and, report that to your doctor and do that every day or something like that. Like,
yeah. And I would imagine that that's something that is, fairly doable, because if phones can measure, like Apple Watches can measure your heart rate, some kind of like app to either teach people how to do that, or, for me as a clinician, what we usually do, it's typically one of the nurses' jobs when they're checking vitals, is to sit there and like actually count the breaths per minute. And so I wonder if there's a way to kind of like you know, figure out how to do that. Just even from watching someone talk or just sitting there and looking at them, like you can often visually sort of pick up on that.
Yeah, no, that's incredibly, I mean, that's incredibly interesting. Yeah, I'll leave it to teams to try to come up with something there. But yeah, that'd be really cool if somebody came up with something.
Yeah. So, there's also one more thing before I forget. There's something just as another corollary to that. There's been some work to measure, like ask people to count 30 and see how far they can get before they have to stop and take a breath, right? So if you can do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, you know, and you can keep going, that suggests that your breathing is fine. Whereas if you have to stop at 8 and take a breath, that suggests that you're like having more true breathing difficulty. So there's a score for that called the Roth score, which people could look up. It's not like totally verified by research as being like a great corollary, but it might be helpful.
Yeah, it's more of
it's ROTH, Roth.
Somebody comes in, like you give us just a rundown of like what happens, like if somebody comes in from COVID, like what's the pattern that has been emerging?
Typically, I think most of what we've been seeing is a lot of people who come in, they don't feel great, they have their cough, they have their fever, and if their vital signs are good, I tell them, look, I'm going to send your COVID test. There's really not much we can do for you here since you're breathing well. Go home, take good care of yourself at home. But if you start developing difficulty breathing, you need to come back so that I can check your oxygen level and stuff. You know, so that's kind of where like
those tests would be like.
Yeah. Okay. If I could like ideally send somebody home with a pulse ox to check and like, so they would know, hey, now I'm starting to have more difficulty, I need to go back to the ER. And, you know, this has been, for a lot of us, really challenging because, you know, if you come into the ER and you look great right now, it doesn't mean you're not going to be great tomorrow. And so like, I have to really try to hammer home to people, this could change and you got to come back if you start feeling worse, you know? Yeah. But I think it would give people a lot of reassurance to have, you know, a lot of people, like, they're worried about going home, understandably, you know, but so I think it would give people a lot of reassurance if they had a way to kind of monitor themselves with numbers or data.
Right. I guess thinking about that, like long term, how, you know, how do you think this is, and we talked a little bit about like, you know, hey, hospitals are going to start needing to do what they typically do other than COVID. Mm-hmm. But other than that, do you think any other, you know, things being bounced around just like, you know, at the hospital or like, you know, things that are going to need to change?
You know, so much telehealth and like telemedicine has happened in the last month. I mean, some healthcare systems were doing it. Mine particularly wasn't doing a whole bunch, but like now all of a sudden, all of us are credentialed to do telehealth. We have licenses in multiple states because it was like, all right, we have to do this. Like we have no other way to do healthcare. And I think like so many industries have changed to the point where like, you know, you can get whatever you want immediately on your phone. And I think healthcare is going to start to go more that way as this has sort of like prodded us to do telehealth. Well, I think people are going to feel that that's more what they expect. And so we're going to have to figure out how to develop more technology to make that more like work better. You know, I think there's a lot that's been done, but yeah.
Well, I'm sure we could have a whole other like conversation about just like telemedicine and telehealth.
Yeah.
And, the different opportunities there. But it would be potentially interesting for people like, you know, maybe to check out the different telehealth options out there. If there's a better way that people feel that people, you know, people can connect. Because you're not the first
and like
that said that.
I think also just kind of going back to what we were talking about with like the pulse ox and the respiratory rate and all of that, there's a lot that you can get as a clinician just from looking at someone on the screen, but there's some like data that would be really helpful and make the tool much more powerful if there was a way to figure out how to get some of those like basic vital signs information from the patient through telehealth.
So I mean, any other things long term as far as like what you see changes, you know, how this thing is, you know, how we're going to come out of this.
Yeah. I mean, I think really more accessibility, like digital accessibility to you know, like more than just the telehealth we think of in terms of like a visit, but as an emergency department person, you know, there's a lot of people who come to the ER for non-emergency things just because they don't know where to go or they can't get an appointment. And so I think that is a potential there for like using telehealth, not just for the visit itself, but for helping people connect to like, you know, I need to see, this happened to me just the other day. I need to see a gynecologist. I can't figure out how to see one. And so I'm going to show up to the ER and like have someone help me get my problem solved, you know? And so some of that, I think that would be like a really valuable thing to give people a way to like access what they need digitally or figure out how to get that appointment or get in touch with who it is that they need. And, you know, like just like so many other industries, like we were talking about, have gone that way, that like, you know, you get whatever you want delivered right to your phone or right to your door. I think more and more that's going to be what people expect. You know, there's also, I think there's been a fair amount of work done on this, but just in general, like in medical, like the medical world, communication between teams is very poor. And so there's been development around like, you know, like there's different programs for teams that are taking care of one patient to share information among each other. But I think that's really going to be important too going forward, is just how to make sure everyone's on the same page, and all of the teams, you know, especially these complicated patients in the ICU, they have like a renal specialist and a lung specialist and a heart specialist and an infectious disease specialist, like all taking care of them. And often there's so much information in this like digital world that nobody's really talking to each other, and it sort of just becomes overwhelming.
Yeah, we've I know at my company we've done some work with like EMR systems. Those systems, at least from our experience, are pretty like, you know, difficult to use, and so maybe even just like a more user-friendly layer on top of that.
Yeah. You know, and for like us on the clinician side, like I think people are just so beaten down by the EMRs, like because there's just so much data that like you have to put in, that I feel like I'm often spending so much time sitting in front of a computer rather than talking to a person. And, you know, so I wonder if there's a way, like, especially with a lot of us are using voice recognition technology to like help, you know, write the note and stuff. But if in the future there's a way for that, like while you're talking to the patient, to have that conversation just go into the note, you know, so I don't have to sit there and write it myself.
Yeah, if a team wants to get ambitious, they could do natural language processing on something to feed into an EMR. That would be crazy. Maybe a prototype in a hackathon, and then could develop it further. Would be fun. Well, and useful. Awesome. Well, I want to respect your time. And is there anything else that you think teams hacking on software should know going on with the
I guess just like I mentioned it, but I think one of you guys could make an app for people to figure out where they can get a test. That would be awesome. Cool. Well, it's really great that you guys are working on this, and I think you know, for people like me who are just I guess in the thick of it a little bit, it's just so cool that there's so many people interested in working on these issues. So thanks to you for organizing, and thanks to everybody that's going to be involved in the hackathon.